As most people know, the DTA, the Dental Trade Alliance, is an active participant in the oral health community. We believe that we're partners with other organizations, and we try to act like good partners and be involved in various kinds of activities related to oral health care system reform. To that end, our foundation has been actively involved in looking for ways to increase access. We are actively involved in a number of charitable groups serving either in an advisory capacity or an active sponsorship capacity to try to advance a number of ideas across the community. We don't specifically have a single idea about health reform other than our hope that eventually we will stop talking about oral health and health, and we simply talk about health, and we know that that includes oral health. Well, clearly, as we are fond of saying, if the ocean is deeper, all boats float higher. We realize that there is an opportunity to do good while doing well. And certainly that's our focus, recognizing that we have social responsibilities, but also that we're in business and we hope to provide more services and care. Well, we believe that certainly there's a percentage of the population, likely over 20%, that has limited access, that can't get care because they don't have the resources, either financial resources, or they don't have the professional resources in their community or close by so that they can obtain that care. One of the differences in oral health as it's currently structured than in healthcare in general and medical services is that people will tend to try to obtain medical services before they obtain oral health services, even if they have the resources. One of our hopes is that we can continue to educate the public so that they understand that oral health should be a priority in their life and seek those resources when they have resources. Compliance with dental plans, compliance with Americans seeking oral care is much different than it is with medical care. Well, I believe it's a couple of things. One, with few exceptions, people may have discomfort, but the majority of the population can move about daily on a reasonable basis, even with oral health problems. You can function. It's not normally debilitating, though we certainly know that kids in school have pain and adults have pain and they lose work, etc. The majority of people who have some oral health problem that needs to be taken care of can continue to function on a daily basis. So it's not an urgency that they feel if they have a heart attack or if they break their arm or something of that nature. People are also, I think, satisfying themselves that they are doing enough in oral care if they use the toothbrush and whiten their teeth. And suddenly then they feel that they have good oral health. And they may be ignoring periodontal disease that's contributing to heart disease or diabetes, etc., but they don't recognize that as a priority in their life. Well, there are lingering issues about the experience in a dental office, I think, that affect a lot of people. People are afraid of needles, they're afraid of pain, even though we've renamed all the toys that dentists use so they're not offensive anymore. They're no longer drills, they're hand pieces, things of that nature. It's still discomfort. I think a lot of people feel discomfort. Frankly, even on a personal experience, though, I know a lot about oral health and the importance, and I practice it. I go to my dentist 3 times a year and take care of myself. I'm not fond of the experience because they use ultrasonic gadgets and they vibrate your head and you walk out discombobulated because you've been laying back with your head back. And so it's not a totally pleasant experience. Some offices and some dentists have addressed that, I think, but we have a long way to go to educate the public that this can be a positive experience in their life. Well, I think the most important thing is this awareness, to give people an opportunity to see the facts so that they can make a determination. They can weigh the benefit of bringing their family to the dentist on a regular basis so that they ensure good oral health, and as opposed to a new flat screen television. I'm talking about the people who can afford, who have the resources, who are the majority of Americans, by the way. 90% of people are employed, and so they have resources. They're just making decisions that are different. I think we have to find ways, and frankly, we are looking for ways to encourage this awareness. I wouldn't say frighten people, but I think that sometimes people need to be prompted to think that this is more about just smiling with white teeth, that it's about heart disease, it's about low birth weight babies, it's about other things that are important. Finding outreach beyond our community, I think, is absolutely essential, something that we hope to do, to organizations that can more easily reach the elderly, who can more easily reach women who wish to become pregnant and need to see a dentist before they do that. So, I think the big idea is to get outside of ourselves. One of the problems in the oral health community is we continue to gather and talk to each other and not talk to others. We need to stop talking to each other. We're convinced. We need to talk to other groups and convince other people that this is an essential part of life. Well, I think we would like to, and that's a part of the awareness problem that we have. One of the difficulties is our community is relatively small in the grand scheme of things.
So it's a money.
It really is a money limiting issue. Mars Corporation spent $170 million to tell us they had a blue M&M. That is larger than most of our members individually in sales, in numbers, obviously. But so it takes an awful lot of money to communicate with the public and try to convince them. Well, I believe there is. I think that professional groups tend to shy from the kinds of things that would be appealing and attractive on those media, because they feel it's beneath them in some fashion. And I mean, just to be completely silly, I mean, if we had rather than interviewing me, if you were interviewing a dancing monkey, like the rally monkey at the Los Angeles Angels game, then people would look at it on YouTube. But just to interview me or you and put it on YouTube, our families will click on and watch.